Hi there, I'm Dave Schulman, CHEST President for 2022, and we're here for another conversation with CHEST leadership. I meet today with Dr. Jaspal Singh. Jaspal, welcome, man.
Welcome, thank you.
Tell the crew a little bit about yourself, what you do at home when you're not here living in CHEST land.
Sure, I'm a pulmonary critical care physician. I've been in Charlotte, North Carolina for about 15 years now, where I'm a part of a large health system called Atrium Health. I have two roles there, or two turbans I wear, you might say. The medical director of critical care practice and education is one role. The second role being medical director of innovation and quality improvement in pulmonary oncology. So I have a lot of fun and I have I have a great time, and CHEST is a big part of it.
I'm glad that CHEST is a great part of it, and you've been a great contributor, and we'll get to that in a little bit. Talk to me a little bit about your first exposure to CHEST and then sort of your climb up to the current position.
Yeah, so I was involved in CHEST as a fellow, got to go to the courses, the free offerings, took advantage of those educational opportunities. But I think when I got invited to teach one of the courses alongside some of the other young faculty as well, I just really enjoyed the interaction. CHEST does a great job with really encouraging not just lecture-based education, but really simulation-based, which I'm a huge passion for. And so it's been a lot of fun. But it's a lot of work, right? You have to kind of invest in yourself. You have to be critical of yourself to how to teach, how to get better at teaching over time. So I spent a lot of time becoming a better educator across my career, and that's been a lot of fun.
Now your current role, I'm going to get the nomenclature right, I hope, one would hope I could get it, is you're a domain task force lead, is that right?
Correct.
What does that mean?
So the domain task force, which I'm still figuring out sometimes, but it's really the idea of getting a bunch of experts who want to really contribute and develop educational offerings related to a simulation domain under what's called a live learning subcommittee. So what the idea is, the mechanical ventilation domain task force really focuses on management of invasive and non-invasive mechanical ventilation for learners in an environment where it's mostly simulation or interactive based.
So education committee, correct. Live learning subcommittee, and then this mechanical ventilation domain task force, which you chair, is one.
Correct.
How many different task forces
There's
are there?
about 4 or 5 others. So we have a ultrasound task force. We have, besides mechanical ventilation, we have ultrasound. We have a bronchoscopy or interventional pulmonology task force. We have and now a new mechanical circulatory support, or ECMO task force. And I think those are the main ones. It might be missing 1 or 2.
Sure. Now, in your particular space of mechanical ventilation, you run a number, right? Those are courses both here at CHEST headquarters, but also at the annual meeting.
Correct.
How many different courses fall under your domain?
At least 2 in the Glenview office, in the simulation headquarters, CHEST headquarters, and then about 15 of them at the CHEST meeting, altogether between different days. Several different courses offered multiple different days, but so ends up being about 15 different courses to if you really piece it out. And
when you construct a course, so this is one of the most interesting things to me. Like I understand globally we want to talk about mechanical ventilation, we want to talk about non-invasive ventilation, but when you're designing a course, how does the team work together to kind of put together the right combination and sort of make the mojo happen with a combination of good lecturers and then hands-on simulation and maybe some self-directed learning? Like, is there a special sauce, is a magic mixture that you work together to make?
I think the secret sauce is working together with the CHEST leadership, with the staff, with the learners, with the feedback. Generally speaking, we'd like to be more interactive, less didactic, and more sort of let's get the learners to touch things, to see things, to watch things, use their senses in a different way than I think other societies or other offerings offer, which is nice. And so then how do you that's nice generically, but then how do you put it together? So you put together in various forms. We sort of have a bunch of us sort of look at each other's proposals and critique them and say, hey, this sounds good, this sounds not so great, let's work on this together and let's kind of get different people. And luckily we have a great team, not just of physicians, but also respiratory therapists, education specialists, and then we get feedback from our audiences. And sometimes they're a win, sometimes they're a miss, and so we keep tweaking that process.
You mentioned the respiratory therapists, the non-physician members, and I think that your domain task force, I don't want to say it's the only one, but I feel like it's the one most well-stocked with non-physician members. I think that's one of the things that at CHEST we struggle with, because we really want more engagement from the non-physicians, the nurse practitioners, the nurses, the PAs, the RTs. How do these, if I'm a respiratory therapist and I really love chest, like how would I potentially throw my hat in the ring, let you know that, hey, I do a lot of mechanical ventilation, I'd like to get more involved?
So there's a process, and the process is typically going through contacting one of the domain task force leaders, or just going to a course and enrolling and seeing what it's about. I think sometimes people want to teach and sort of get involved, but they haven't even seen what we do. And seeing what we do oftentimes is actually not as easy as it sounds.
Yeah.
And it's not for everybody, because it actually does require certain amounts of stresses and strains and skills. That's not for everybody. And some people are great at it, some people are not so great at it, and that's okay. So first thing is figure out whether it's what you want to do. Secondly, then try to attend or at least learn of a course or at least observe a course. And then three, if that's kind of what you see yourself having a passion for, show us and come on up and then contact us. And we'd love to see more people get involved.
You mentioned earlier today, actually I think on Twitter, something that sort of is near and dear to my heart, which is sort of watching other people teach. So I'm going to give you a chance both to talk about people and about toys. We'll start with the people first. Like you can compliment one of your colleagues here or someone else, like what's somebody you've watched, who is somebody you've watched teach and you've said, man, that person is magical, they've got some skill. So you can name check them if you want, and what is that skill that you've seen that you're like, wow, that's really cool, I'd like to teach a little bit more like that?
Yeah, so I've been blessed in my career. I've had some great teachers and mentors, and I've had a few of them. But I was to name people specifically for especially the Mechanical Ventilation Task Force, we have a couple of people that are just phenomenal. So I have Dr. McIntyre, I trained under, I worked under, I learned from him, and I still watch him, and the way he with his knowledge base, does a great job of taking some very complex concepts and making them relatively easier to understand for people who are not as advanced, right? And I think that's great. Very polite, very cordial, very, not standoffish. And I would say I have another person who's very involved with is Dr. David Boughton. So Dave is also equally just sort of super knowledgeable and just has a way of thinking through things in a way that it's great to watch. And over time, you get to know these people, and they're wonderful people, and so they're gems of clinicians, and so to get to watch them in action in different domains, it's really fun.
So I've gotten to know Dave a little bit more. So Dave's been an active participant in our Pardon the Interruption sessions, and he actually shockingly won one year. We still don't know how it happened. We think it was some sort of a voting error. Another great thing that I think is sort of chest-wide, but also specifically in the simulation space, are the cool toys. So like, what's a cool toy that maybe 5 or 10 years ago you're like, well, that can't exist, and now it's something that you have incorporated into your simulation component?
Yeah, there are a lot of cool toys. There are a lot of cool toys that are out there, and without getting too much in the detail, I would say that some of the mechanical ventilation simulation toys that are out there, sort of the ability to simulate diseased lungs, it's pretty neat. Like you can't do that like you can very easily in other simulation environment. So I teach simulation at my home institution, for example, and there are certain toys that are just not within the purview of most simulation centers. And so CHEST has a number of different things, including a couple of different advanced ventilators and such. And we have a few sim rooms, so which is particularly cool, is you can go from room to room to room and actually have, in a very fast and high yield fashion, have participants go through and see different scenarios quickly. And in an hour, just the amount they can learn and understand and in a different way than a lecture can, really gain, and you can see that aha moment just come through in so many different ways, and it's so fun.
Rumor has it, I've not seen it yet, that there's also a biological sample in play today. Is that right?
Correct. We have some pig lungs. We have some other things that are there.
What do you do? What's the advantage of using a pig? Like, what is the advantage of actually using biological tissue in a simulation like this?
Because biological tissue is it's one thing to sort of have a bunch of dials and buttons. But when you actually see it actually translate to sort of like, oh, this is how real tissue behaves when I put it under certain stresses. And I think that helps the learners really understand, like, okay, that's what I'm doing. When I adjust a ventilator or if I do a procedure, this is kind of what's happening to a human, and you can make that relationship a lot more easily attainable in terms of their mind understanding what's happening when I make a certain adjustment.
Awesome. All right, so I'm going to close with a couple of rapid fire questions. These are things that we did not prepare you for, but things that we sort of asked others to get a little bit more to know you from a sort of social, sort of collegial standpoint. What is a guilty pleasure movie? What's a movie that, maybe it's on TV and you're like, nobody likes this movie, but I'm going to watch this movie every time I'm flipping around and it's on?
Yeah, I'm guilty pleasures Fast and Furious.
Really?
Fast and Furious series, it's always on TV. My family hates it, but I will watch it.
I don't even know that's a guilty. So I have to admit, I've never seen one.
Oh,
I know they're
you're
big.
missing out.
No, I know I am. It's on that thing that I should. So, but I feel like that's sufficiently popular. Like everybody kind of loves them, and I'm always embarrassed to admit in public that I've never digested any of them because I feel like it's all about crashing things and explosions and.
Yeah.
But that makes you happy.
It's just entertaining.
Okay.
And I think it's fun.
What's the we'll now flip to music. So what's the song that when it's on the radio you're going to sing it in the shower loudly and proudly as long as nobody else can hear you?
Well, I play it at the Sim Center, so I can't do it at home, but no diggity. Because you gotta when you have a patient, you gotta bag them up. You gotta bag them up, right?
That.
So we play that during the sim lab to demonstrate bag valve masking, and it's a lot of fun.
All right, last one. What's your physical on-planet happy place? What's the place that you or you and the family will just go and just going to see it and enjoy it and absorb it just gives you joy?
I think I would have to say our temple. I think our temple is just our spiritual home to us is a very important place where I just go there and I just relish being at peace.
Awesome. Doctor, thanks so much for your hard work. Thanks again for joining us and meeting more of our outstanding leadership. If you want to get more involved in the education space, please come find us either here in Glenview or at the annual meeting. Hope to see you soon.